therapy that feels like home, which automatically means it's all about creating a certain environment, an atmosphere, and a convivial feeling in which the client may feel comfortable, accepted, unjudged, unhurried, and embark on that therapeutic journey. And speaking of creating conducive environments, at the very outset, I'd like to thank the management of Sea Scheme Town Coffee in Jaipur for letting us use this location. It is one of those social environments that is extremely popular and especially beloved to me. So, coming back to therapy that feels like home, that is the theme and the topic for the 4th edition of Soft Spaces, brought to you by Driveway Devi and Khushiyaan Clinic. And it's extremely important to recognize and seek to create that environment, because as it is in our country, it is very difficult for a lot of individuals to seek help, to embark on that journey. It's a fair assumption, I guess, that people are already coming from a certain negative predisposition. If not negative, there's definitely a degree of trepidation that they have and feel. And if to that we add a therapeutic environment, which seems to them like it's a bit harsh, a bit cold, a bit clinical, then we can permanently put an end to that very, very important endeavor. As usual, we are joined by psychologist Khushi Kumar, and we will talk about the importance and the specific elements that go into creating this environment that makes therapy feel like home. Khushi, thank you very much once again and welcome.
Thank you, Kartik. This topic is the essence of how I practice, and it is something very close to my heart, because being someone who's not only a therapist but also someone who has sought therapy at various junctures in life, and not being able to find the correct person to interact with, to share your worries with, to share your nervousness with, whether it's exam anxiety, whether it is a life transition that is taking place. And that journey itself is so overwhelming to find the correct therapist, and then also to invest a certain amount of money while you're doing that is in itself a burdensome process. And many of our therapists in India at times forget that the client is not coming to be labeled, to be treated as a case. At times it's listening, it's holding, it's hearing what your client has to say. It's not always observation, it's not always trying to make a meaning out of, oh, what does this body language cue mean? Oh, their tone was like that. They're talking in a fast-paced space, and it's not that. It's providing a space where your client is feeling heard, he's feeling felt, he's feeling or she's feeling comfortable and at home. And I don't blame anyone, because for the longest time psychology has been associated with the Freudian image, where the client is sitting on the couch and there's a therapist behind that client who's scribbling down notes. And that image itself to me brings in a lot of unease. There's no eye contact, there's no warmth, there is no the personal human touch is missing. And that's how psychology was seen for the longest part of the 20th century. It's only in the 1950s that Carl Rogers came in and he gave in his person-centered therapy, where he talks about unconditional positive regard, which is how we as therapists make our clients feel unjudged, how we provide empathetic response, and how we just provide a comfortable and safe space for them to explore their emotions, to explore their journeys, to explore their stories, their experiences. And there's a quote that comes to mind which Rogers has very prominently stated, that what is personal is universal, and it is not the technique but the relationship that starts the journey of healing.
How beautiful. I couldn't agree with you more. And in my limited observation, very quick couple of points I'd like to share. There is something called bedside manner. And in the medical profession, by and large, it is recommended that doctors have a certain positive bedside manner. It so happens, and I know from my very close doctor friends, that surgeons in particular tend to become a touch impatient and desensitized, and therefore you see a vast difference between visiting a doctor with a good bedside manner versus one who doesn't have a good bedside manner, and the way the patient will feel immediately upon that interaction will also therefore vary vastly. I know doctors of physical faculties who pretty much half cure their patients just through their bedside manner, by coming across as understanding, empathetic, and being good listeners. And that is the kind of difference it makes. So that is one point I wanted to share. The other point I wanted to share is that we must understand that insecurity is a very basic, primal human feeling. Having trained in filmmaking, I can tell you that when we used to have our directing classes, one of the first things we were told is that actors need to be treated with kid gloves. They are in a place and space where they're already feeling vulnerable. You are expecting them to emote a range of emotions. And then if you don't treat them right, and if you don't treat them with care and sensitivity, they are bound to go into a shell. We've had examples in Hollywood as well as in India where, I'm not going to name them, but directors have been very harsh and have been known to, in fact, slap around their actors. I don't know how they solicited the performances that they envisioned, but I can tell you that the vast majority of directors who are extremely tuned into the psychology of their actors are always able to not just solicit wonderful performances, but forge a pretty much lifelong bond. So it's really, really important to be sensitive and aware of the conditioning and mental makeup of any human being, so much more so when it comes to therapy, because as Khushi very rightly said, it is all about human connection. So how about we begin by you telling us some critical ways in which this kind of environment should be and can be created?
Okay. So what I do with my therapy sessions particularly is that I try to establish rituals that are consistent, that are warm, and that provides a sense of stability to the client, and it also brings in that regularity that comes in with the therapy session. So it can be something as small as, I always begin my sessions with a question, so what's on your heart today? And that's a repeated question, and that's a way that I start most of my sessions with, or giving them an option to sit wherever they want, or providing them with the setup of how the lights should be. Do you want dim lights? Do you want bright lights? Are you feeling, always asking them this question, do you feel comfortable if we talk about this today? So, setting the tone, your words, structuring your sentences in a certain way, which involves the client in the process rather than the client feeling that they are coming in for observations and feeling judged about what we are writing in our notes. And I also make it a point never to use a writing pad in front of my clients, because of course they're always going to think, what did I say? Okay, I've said something and now she started writing. So I always try to avoid that. So these are a few ways that I use to make my client always feel welcome, safe and comforted in my clinic.
You made absolutely logical and critical points. Of course, being empathetic in terms of one's communication and language usage and framing of sentences is very important, but I suppose a touch obvious. What I want to explore a little more is the absolutely vital importance of mood and ambience, because it has such a direct and implicit impact on how we feel. Each of us, consciously or unconsciously, has preferences, particularly when it comes to the temperature of the room, the aroma of a room, the lighting of a room. There are certain hospitals or clinics that we go to where we get an extremely cold, eerie, morbid even feeling and vibe. If that were to be a pervading atmosphere in a therapeutic setting, I don't think much is going to be accomplished.
Yeah.
And at the same time, if one makes the effort to solicit the preferences of the client and consciously creates that mood and atmosphere that is preferred by that person, naturally the results and the journey will be totally different. I want to also quickly talk about a point that you mentioned earlier, and at Driveway Devi we go hoarse talking about this. Very quickly, I want to say that this entire arduous process of finding a therapist in the first place is very, very important, that we build a certain amount of patience, persistence and resilience, because it's really like dating. And it could be the most qualified and well-intentioned therapist in the world. It could be that you are the sincerest and most well-intentioned client in the world, but because there is such a human X factor and element that governs this entire interaction, it is entirely possible that the two of those very sincere people don't establish a kind of rapport that will lead to positive results. So once, twice, thrice, please do yourselves the favor of having the tenacity to go through that trial and error process until you arrive upon a therapist who works for you, and vice versa. And to the point about mood, it also gives me an opportunity to ask you something I've been wanting to ask you, but now it's in context. So every Tuesday evening, we host a safe circle meeting. And, I'm not a mental health professional, and therefore that is something that is put out there very, very clearly upfront. Having said that, it is a space that provides an opportunity for anybody to come and talk about anything that is distressing them, and if that individual so wishes, to get perspectives from the others present or from myself. Number one point, a lot of people who come into our office have told me and complimented me on the mood that has been created in that tiny little modest room, which is warm, which is inviting, which is cosseting. And number two, and that's the question, because I am not a therapist and therefore a lot of rules that would apply to you don't apply to me, one of the techniques that I use in order to positively predispose and make the people attending these meetings comfortable is to talk about my own woes and distresses. In the absence of that strategy available to a professional therapist, what are some things you do by way of by way of saying that also create that comfort?
So, of course, with my clients, I try to establish a relationship. So it's not just holding their hand down the journey. They are also helping me in my professional journey as well. So it's a reciprocal relationship that we both are in. And even though it's very professional, however, since my profession requires me to bring in that personal touch at times where I feel comfortable, where I can see that my client would want that story that is relating to their situation, their own scenario that they are in. So I bring in the personal touch, I bring in the personal stories, or I bring in client stories that are similar to theirs. I tell them, oh, I've worked with something similar, or I've read about this, I've read about a case study like this, I've read about what we are trying to do today, and I've done my homework. So that in itself makes the client feel at ease that, oh, she's putting in the effort, oh, she's doing extra reading for me, oh, she's doing that research for me, she's trying to correlate things with her own life, with her own experience that she has. So that in itself makes the client feel very stable, very comfortable. They also at times tell me that, oh, you read a book for us, you read 3 chapters for us, and I have not seen or I have not heard from my friends their therapists do that. So providing them and making them feel that it's not just that 1 hour that I'm giving to them, it's also what is happening in the background, what I'm doing in my personal time and taking time out for them. So I saw this, I had gone out somewhere, I was traveling, and I saw this place, and that place reminded me of my client. So I clicked a picture and I sent that image to them, and I told them that I feel that if you were here, you would feel at peace. And that message itself brought them so much warmth, peace, and a level of understanding that was not present till that moment. And from the next session onwards, they just felt more open to me, and they opened up more about their experiences, their life struggles, their coping mechanisms, and that's what a therapist wants, to get to know their client better, to provide them with that space that they are able to talk about things which they hide from in their regular life.
That makes perfect sense, and again, I couldn't agree more, because a very similar strategy I have used quite successfully with many of my students, where I've had on occasion students who have, despite 4, 5, 6 sessions, absolutely refused to budge and open up and sort of become comfortable. And what I do with them is I make a conscious effort to educate myself in terms of various domains or worlds that a person of that particular age, gender, and community inhabits. What I mean is, what are they watching? What are they listening to? What are the brands they're fond of? And superficial as it sounds, the moment I am seen to be aware of that information and can construct a conversation around, oh, what a beautiful watch you're wearing. If this model has just come out, I'm a huge fan myself, planning to get it for my daughter. There is an immediate sort of shedding of inhibition and those walls that tends to take place. And really what it does, and the example that you shared, is I think it exemplifies and demonstrates to the client a deep understanding of them and of their states of mind, which is what brings in the comfort. Quite a few therapists and mental health practitioners have told me this, and it makes a lot of sense, that there are often times where, especially clients who are afflicted and sort of battling fairly serious conditions, can be a bit mercurial. They can even exhibit and slip into violent behavior in session, which can be a security concern. And therefore, there is a possibility that security or certain reinforcements has to be called in to manage that situation and for the therapist to safeguard themselves. You mentioned a beautiful example of having taken a picture at a certain location and sent it to your client. Now, also, there is that very thin line but significant line between professionalism and because we're talking about creating a family like atmosphere, at the end of the day it is family and our nearest and dearest ones, ironically, we are most poorly behaved with. So my question therefore is, how do you guard against that line being breached, and what can you do in situations where that line has been breached?
Okay. So in psychology, there are two concepts called transference and countertransference in therapy. Transference is when the client starts transferring their relational or traumatic backdrop onto the therapist, and they start seeing their therapist as their abuser or as the person from which they've not received the love and the support that they want, or the person that has been the aggressor with them. And I feel that even though it's a very important step in the healing journey to feel this transference. Why? Because it's a way for them to vent the emotions that they have stored in their body. The second aspect is counter-transference. Now, counter-transference is the tricky aspect because it is felt on behalf of the therapist. So the therapist starts feeling feelings of aggression or opposite feelings that the client is trying to bring in, and that in itself can get very messy for the client and for the therapists themselves. And it is very important, therefore, to have peer support, to have supervision, while especially in early career stages of a therapist, where you can discuss your cases openly, in a very safe, comforting space. And of course, while you're doing that, you have already informed your client that you are under supervision, and that there will be times where you will be discussing the case with a senior therapist. And it is through the identification of these emotions, these irregularities that may take place, which are also regularities in the therapeutic journey, that one can provide with a support which is non-judgmental, empathetic, and comforting to the client, which will help them move towards their healing phases. So when the therapist in such a situation, of course, there is always the option to terminate therapy, which is the last resort. However, to work through these feelings by using techniques that may bring in a third person, a third object, in itself can help in such scenarios. And yeah.
That's absolutely clear. Unfortunately, there is a stereotype that's been propagated and perpetuated by popular culture, particularly by films out of Hollywood again, which is what my layperson's understanding of the term transference was until you clarified it, which was that you invariably find a man in therapy with this gorgeous looking therapist, and then he falls for her, and that is what has been for a long time called transference. Is that true or not, or is transference only considered transference when it's negative perception of, as you said, becoming the perpetrator or the aggressor?
No, so it can be both ways. It could be a negative perception and it could be a positive perception. So the scenario that you are describing is a classic textbook scenario in which the client falls for the therapist and probably is coming for maternal detachment, right? Because they've not received that maternal care, they've not received that love, that support that the therapist has provided, and it's the first time that they are able to feel those positive feelings, again that unconditional positive regard that Rogers has clearly given us as a guideline to follow, because it is again a humanistic profession that we are trying to build, and he brings in the humanity in the profession. So it is something which does happen, it is something which is common, but it is the therapist and the way in which the therapist deals with the situation that matters.
Now, we've spoken about a certain way of communicating, and I think as a communication skills educator, I can tell you that it's not just the words and phrases and expressions that we use, it is also the tonality that conveys so much, and the entire actually gamut and range of emotions. You can be saying allegedly something sweet, but if you say it in a certain tone, it won't come across that way. So in your therapeutic practice, what is the role of tone, and can you explain it a little bit?
Dr. Stephen Porges talks about polyvagal theory. He is the founder of polyvagal theory, in which he talks about how our nervous system first responds to the environment in which we are placed, and he talks about the neuroception of safety, in which he explicitly states that before we hear the words, before we respond to what's being said to us, it is the tone that sets in the measure of safety, our response to it. And similarly, in my private practice, I try to create a safe space in which I use words which make my client comfortable, which make them feel warm, which make them feel welcoming. So instead of using words like, okay, you have anxiety with comorbid depression, I tend to place my sentences with, okay, do you feel nervous in your day-to-day routine? Do you also feel sad in your day-to-day routine? Instead of very blatantly putting those words out there, which may be very helpful for clinical diagnosis and universalizing the process of diagnosis internationally, but it is not helpful to the client. Why is it not helpful? Because our nervous system starts responding to the body language of the person. How is this person talking to us? How is this person why is their pitch so high? Is it a voice or a voice problem, volume problem that they have, or are they being angry at us? So our nervous system itself is activated on the very cue of the tone in which the words are being said to us.
And I want to quickly draw the very important distinction that what Khushi is suggesting, and please correct me if I'm wrong, the strategy is not to sugarcoat. You are still very much in the realm of truth and reality. It's just that it all comes back to sensitivity and a way of conveying things in a sensitive manner, which is both your style of conveying and the content that you choose to convey it through.
Yeah, true.
Wonderful. It might be a appropriate way and an opportunity to conclude this session by saying that we recently did a session with another therapist on our platform where we talked about artificial intelligence in therapy. Yeah. And we had sort of concluded that session by saying that as long as artificial intelligence is augmenting but not replacing the human element in therapy, it should be okay. And this entire conversation and the fact that we're talking about creating an environment, the fact that we're talking about understanding, empathy, validation, all of these very, very critical facets that are embodied, to my understanding, only by human beings, which is what makes us human, is yet more proof that the human connection and that umbilical cord that exists between a therapist and a client is simply not possible between technology and a client. Yeah. And it's very, very important that client and therapist both are sensitive and aware of these elements that make up that conducive atmosphere, and work and strive towards it. Khushi, thank you so much as always. It's been a wonderful conversation, and I look forward to us having our next dialogue, and we will see you in the next one.